Hi, everyone. Welcome to our Cancer Fit education for this week. Remember, you can have your Cancer Fit education booklet that you received at orientation or you received by coming to the fitness center here to pick it up. Remember, I'm Melissa Moore, and we are going to do just a Cancer Fit education. And then the next following video will be a kind of exercise video. Today is not so much focused on exercise, and we'll talk about that, but you will get a kind of physical activity video after this. So today we're going to be talking about peripheral neuropathy. So peripheral neuropathy. So your page should look like this. It has a little foot on it. If you go to your table of contents, it's probably 1, 2, 3. It's right before what we did last week, which was fall prevention. So we're kind of going out of order. But so right after flexibility, before fall prevention, you'll see peripheral neuropathy. The page has a little foot on it. Go ahead and pause the video if you need to find the page. Remember, if you don't have your booklet, that's fine. I'm going to go ahead and share my screen so you can see the page. This one can be a very complicated topic, but we're just going to try to simplify it and hit the highlights. That way, if you have any questions specifically related to it, definitely you can ask your doctor, because it is something that they would have to be more involved in. Or if you have just general questions about it, then of course you can ask me. So let's go ahead and share the screen. And here we go. All right, so you should see the same page that you have in your booklet, or you can follow along here. We're going to be talking about peripheral neuropathy. So that is just a fancy name for nerve damage. So if you look at the little picture above, it has a lady walking on some tacks, and that's kind of a little sums up how peripheral neuropathy may feel. Definitely one type of peripheral neuropathy may feel like that. So you're probably thinking in your head, oh, I've had that. So let's go ahead and just get into it. So reading here that top paragraph, some cancer treatments do cause peripheral neuropathy or nerve problems that damages the nerves. So if you think about chemotherapy, sometimes it can damage your nerves because it's trying to target those bad cells. Sometimes it targets, the nerves on an accident. So you have that lasting effect. So the nerves, of course, carry information from the brain to the other parts of the body. So the nerves go from the brain to, the muscles and other parts of your body, sometimes organs. So if you do have damage to your nerves, you may experience weakness, numbness, that tingling sensation, or burning. Depends on which nerves are affected, and we'll talk about the different types of nerves and if they're affected, what it should feel like. So if you know anybody that's a diabetic, or if you're diabetic, very similar to what happens to diabetics, that nerve damage. But this, of course, is caused by cancer treatment and not diabetes. So there's 3 types of nerves that may be involved. So you have sensory nerves, you have motor nerves, and you have autonomic nerves. So let's talk about the sensory nerves first, and that I think is the more common, or the ones I hear about the most being damaged. So these nerves help you feel pain. They help you feel heat, cold, pressure. So any senses. What they call the sensory nerves. So pain, heat, cold, and pressure. Any type of feeling. So if you have damage to nerves that help you feel, you can only imagine the symptoms you may have. So you may have tingling, numbness, that pins and needles in your feet or your hands. It may spread to your legs or arms. So kind of if you think about when a body part falls asleep and you don't have that blood flow and it's kind of waking up, that's how it may feel as well. You can't feel hot or cold sensations. So you can't feel a really hot stove. You can't feel if your hands are really cold. Or you can't feel pain. So you may step on a tack or step on something like that, and you just don't feel it. And we'll talk about if you can only imagine what problems those can cause if you don't have feeling. So let's go to the next set of nerves. So there's also motor nerves. So those are the nerves that help you move your muscles. That's why they're called motor nerves for movement. So if you have damage to the motor nerves, of course, you can imagine you have weak or achy muscles. You just ache all over. You may lose your balance or trip easily just because your muscles are weak. We talked about balance last week. And then it may be difficult to button shirts or open jars and things like that. So causes muscles to twitch, cramp, or muscle wasting. So, if you have a cramp in your calf or you have a twitch, that could be, damage to the motor nerves. It can also cause a difficulty in swallowing, breathing, if your chest or throat muscles are affected, because you, of course, you have muscles in your chest and your throat, and if you have weak muscles in your chest, or of course, you may have trouble breathing. So the last set of nerves are the autonomic nerves. So those are the nerves that kind of go to help control blood pressure, your digestion, your heart rate, temperature, urination, and things like that. So if you have damage to those autonomic nerves, you may have digestive tract changes. And I know that that is a common symptom of chemotherapy. So you may have constipation or diarrhea, because your body is having trouble regulating that, your digestive tract. You may feel dizzy or faint due to low blood pressure. So sometimes, a lot of times people, when they go through chemotherapy, their blood pressure is really low. So if you're having that dizzy or faint feeling, then you may be, we'll talk about what you need to do, but that could be caused by low blood pressure, sweating problems, so you either sweat too much or too little, urination problems, so you have trouble emptying your bladder, you're leaking urine. So that could be, again, if you're having any of these symptoms, any at all, and you've had chemotherapy and you think they're linked to nerve damage, it is very, very important that you talk to your doctor and let them know right away, because it could be medicine they can give you, or maybe medicine they can take you off of, to help control that. So those are very serious problems, and that would disrupt your life significantly. So you do want to talk to your doctor above all. Um, so ways to prevent or manage nerve damage. So first things first, if you're having any of those symptoms, talk to your doctor first. So these are just some kind of coming up with some things that you can do, but definitely talk to your doctor. Um, but preventing falls, that's one important. So we talked about the sensory nerves and we talked about the motor nerves. Those are two nerves that if they're damaged, then you may have balance issues, because one, you don't have that sensation feeling in your feet. So if you can't feel your feet, of course, you're going to have balance issues. And then if your muscles are weak due to damage from motor nerves, then you're going to have balance issues. A great topic to review was our topic last week. We went over balance and how to prevent that balance, and we did balance exercises. So this is just should be a review. So help prevent falls as much as you can. So remove your hazards around the home. So if there's anything that you can trip over, get it out of the way. Wear sturdy shoes around the house. Remember, we talked about, either wearing socks with the grippers at the bottom or sturdy shoes, something that gives you some type of stability. If you don't have stability, the more risk you are for a fall. And then, of course, getting up slowly after sitting or lying down. A lot of times, especially if you have damage to those autonomic nerves, we talked about having low blood pressure. If you get up too fast, you can get dizzy, faint, and then, of course, you're going to fall back down. So you really want to take your time, especially if you're having that symptom of dizziness or faintness. You want to make sure that you're being careful getting up after sitting or lying down. Definitely to the sensory nerves. So if you have to take extra care in the kitchen or shower. So if you have damage to those sensory nerves where you can't sense heat or cold, you can burn yourself very easily. So make sure that you use pot holders in the kitchen, because you may touch a hot pot and you may not realize it's hot. I mean, we do it all the time. We don't realize it's hot, but of course we have that sense. So we quickly take our hands away. But if you don't have that feeling, you may hold on to it a little bit longer than you should, and of course have an injury. So you want to make sure that you're using pot holders, especially if you know you don't have that sensation in your fingers. Be careful when handling knives or sharp objects, because you can't feel, we know when we kind of cut our finger, but if you don't have the feeling, you may go a little bit further and need stitches. So being careful, paying extra attention, not taking anything for granted, that like sometimes I've heard people say, they've chopped so much that it's like, that it's like second nature to them. You should really be paying attention. So, ask someone to check the water temperature, or a lot of showers and things like that. I think water heaters have a limit that you can put the heat on. So if you know that you're having trouble regulating, make sure that something is not too hot so it doesn't scald you. You can turn, I think you can turn, don't quote me on that, but I think you can turn the temperature down on the water heater so it only gets to a certain temperature. So protect your hands and your feet. So wear shoes both inside and outside. So this what we kind of link to diabetic. So when people are diabetic, they always tell you pay special attention to your feet, because you can get splinter in it. You can step on something and you won't feel it, and you can go for days, and then you can end up getting infection, and that leads to a whole new problem set. So if you know you're having numbness in your feet where you having that you can't feel, make sure you are wearing shoes both inside and outside to kind of protect your feet against any injuries. Check your arms and legs and feet for cuts, scratches every day. When you take off your shoes, especially those parts that we don't have a sensation, make sure you're looking. Um, when it's cold, wear warm clothes to protect your hands and feet, because if you can't feel how cold it is, fortunately, if you live in North Carolina, it doesn't get too cold. But if you live in an area where it gets really, really cold, you want to make sure that you're wearing warm stuff so you don't get frostbite, because of course you can't feel. Of course, neuropathy can be worse in the winter due to reduced circulation. So, if anything is cold, the blood flow doesn't flow as good to those areas. When it's warm, you get more blood flow. So if it's already cold and you're not getting blood flow, and then you already have neuropathy, then that can make it worse. So you want to make sure that, definitely, I know a lot of people tell me that they have the worst time in the wintertime with neuropathy. So you want to make sure that you're dressing warm as you can to protect your hands and feet. Of course, ask for help, slow down. We always talked about that. And then above all, remember, ask your healthcare provider about pain medicine. So there is pain medicine they can give you for neuropathy. The gabapentin is the medicine, but or any integrative health practices, anything that they know of. So remember, if you're having any of those symptoms, doctor first. And these are some things that can help you. Of course, certain exercises can help improve your circulation and your range of motion and your blood flow. Of course, exercise in general is going to help get the blood flowing a little bit. So, of course, strengthening exercises can help with muscle weaknesses. So, of course, if you have muscle weakness because of the motor nerves, then of course you want to strengthen those muscles, identify those muscles and strengthen them. Of course, balance exercises, you go over that. Last week's video had the balance exercises, and then of course yoga and other practices, any type of meditative practices can help you with pain if you don't want to take medication. So again, that's quick, short. It's not an all-encompassing. Again, if you're having any of these symptoms that you feel like you may be experiencing nerve damage from your treatment, talk to your doctor first. There may be a something easy that they can give you, maybe some medicine, and then if not, of course, these are some things that to kind of supplement your doctor's advice, not to take the place, just to add to. That is it. Again, pretty simple, easy. Remember, doctor first. Just talking about nerve damage. If you have any questions, just let me know when I give you a call. Or remember, you can always call me here at the fitness center, 336-878-6221, or you can email me, meilimoor@wakehealth.edu. All right, thank you. Stop the share. All right, now we'll stop the recording.